And the Ontario government looking to make a final push to get the remaining population fully vaccinated. However, we're seeing daily information by the province showing fully vaxxed people getting sick. And we spoke with infectious disease experts and epidemiologists to find out why. With over 75% of Ontarians 12 and over fully vaccinated, the province continues to show that a very small percentage are still finding themselves infected and in some cases hospitalized. Epidemiologist Dr. Pragbat Jha says this doesn't show that the vaccines are failing.
The vast majority of Canadians being vaccinated, more of the infections that are reported you will get more infections among the vaccinated populations now being reported. It's just the law of numbers.
Dr. Jha says in terms of the fall fourth wave, Canadians should keep an eye on other highly vaccinated countries like the United Kingdom.
The signs very much are suggesting, yes, they're certainly getting another peak in cases, but reassuringly a far, far smaller peak in deaths and hospitalization.
Israel, on the other hand, is a country that was applauded for its early and swift vaccine rollout, but could be paying the consequences for their good intentions.
Israel may have a couple of issues going on. They vaccinated very, very early, one of the first countries to get going, and so there is potentially a waning of immunity.
Which is why the country has already started administering booster shots. Ontario Chief Medical Officer of Health, Dr. Kieran Moore, was asked by CHCH Queen's Park producer Randy Rath a question many are wondering. Will we ever live a pre-pandemic life? Dr. Moore says vaccines are the way out.
The higher we build our population immunity, and that's somewhere over 90%, the less this virus will be able to spread amongst vaccinated and unvaccinated.
Infectious disease expert Dr. Fiona Smale agrees.
Will it go away completely? I'm not holding my breath over the next few years. So there will be some living with it, but we still have to recognize that vaccination is going to be a very effective tool to controlling it.
Dr. Jha says we still need to observe the Delta wave in full to really see where the province goes from here.
The optimist would say, well, because it's so infectious, it's going to shoot up quickly and come down quickly, and then basically it's out of your system. It's out of the population system. The goal should be to keep immunity high, which might well mean potentially moving to the equivalent of annual flu shots.
Dr. Jha continues to implore that rapid testing and contact tracing should be more readily available during this fourth wave and after to keep track of the virus, an initiative he says he is yet to see full commitment to.